My subspecialty is the psychiatry of intellectual disability. So we support people with learning difficulties and also with neurodevelopmental disorders such as autism spectrum conditions and ADHD. And we support people who have mental illness and also epilepsy. In a typical week, I'll see a lot of our service users or patients, and they may come to see me in my clinic, or I might go to see them at home or in day centres or at their GPs or in hospital.
I also do a lot of multidisciplinary working, so lots of meetings, lots of time to talk about patients and to think about how to do things best. I'm also involved in research and teaching.
I think what's really great about my job is the people I work with. So we work with some really beautiful and inspiring service users and patients. We work with some very caring and affectionate family members and carers. And we work with some very hardworking and dedicated and compassionate colleagues. So that's what I really love about my job, the people I work with.
I like the variety. And I like having the time to really get to know a person and to be able to look at them holistically, to get to know the families and to think about ways to work with them to try and help. Sometimes it's frustrating when there isn't enough money or you think that things could be made easier if there was more provision for support workers and more pay for social services.
Sadly, some of our service users just have really sad stories and have had very difficult lives. They may have encountered a lot of loss, stigma, discrimination, and sometimes even, sadly, abuse. It can be challenging and it can be frustrating at times. Sometimes things happen very slowly, but of course change doesn't happen overnight. And I think it needs a particular personality, but I would absolutely recommend it because I think it's a wonderful area to work in.
We don't have a lot of protocols. There isn't an easy answer for most of the problems we see, so it really does keep me thinking. And I hope that over the years that will be one of the things that helps me to stop burning out, because actually each patient is entirely different. And each time it makes me really wonder and think and reflect.
Maybe because of the people we work with, I get made a lot of cups of tea. Offered a lot of biscuits, toasted sandwiches, spaghetti bolognese. And in fact, this year, one of my patients, probably a few of them actually, invited me over for Christmas lunch. And some, when I told them unfortunately I couldn't make it, asked if they could come round to mine instead.